Really, it's some of the best data we have because, you know, for those of you that are really actively involved in this work, you know that our data lag behind by a couple of years. We don't have current data, as you can see here. I might be blocking it with all the call-in numbers, but you see that this data even is from 2017. This survey will be re-administered in 2019. But this is what youth are reporting to us, middle and high school youth. 1 in 6 have seriously considered suicide, and that's in the 12 months preceding this survey. We know that it's not that many less that have actually had a suicide plan, according to their self-reports, and 1 in 10 have said that they have attempted suicide. Now, we also know that about 1 in 50 youth in these grade levels have reported that they needed some sort of medical treatment or intervention to save their life. So that's a pretty big jump from the 1 in 10. And we know that this is an issue really plaguing our field, that we don't have a good handle on our suicide attempts. We know that adolescence is really the time that we see the greatest number of attempts, and that I think is really reflected here in these data, but we don't often know about a youth attempt unless they do end up in the hospital. So that's definitely something of concern, and more the reason to do this work all across settings, but as our grant currently has focused in schools, that's where we've seen a growing need. So these are the goals of our present grant. So as Jamal mentioned, this started in 2014, and we're about to come to an end of this funding cycle at the end of September 2019. And really the goal, well, I'll also say that this grant coincided with the passage of Act 71, which many of you are probably familiar with, but that's school legislation. So Pennsylvania is now one of 37 states that does have legislation requiring there to be training for school staff. And our requirement is 4 hours every 5 years. The legislation also does require schools to have policies and procedures in place for suicide prevention. And that really should include prevention work, intervention, responding to students that are at risk, and also postvention, which we know that, and it's not just schools, but schools and communities have really struggled, you know, in the aftermath of a suicide loss of a youth in terms of the response efforts and all of the follow-up that needs to happen from there. As well as things like reentry, which, you know, that requires a lot of coordination between youth serving systems, and it's often been an area of struggle for schools in particular that we've worked with. But, you know, we also hear as well from the treatment providers that there's just a breakdown. That's really where we often see youth falling off from when they have an identified need and then are being referred to services, whether it's step down from hospital or treatment of some sort, and then returning into, you know, the community, whether it's their school or their college campus or work, and that support and coordination isn't always in place. But as far as this grant goes, we really wanted to increase the number of people trained to identify and refer youth that might be at risk. We have a big focus on screening and referral, and we do a lot of work through SAP, through the Student Assistance Program, so I'll share some of that data with you a little bit later in this presentation. And then we've also had an effort to increase the capacity of clinicians and treatment providers to offer evidence-based treatment approaches in terms of both the assessment and intervention pieces for suicidal adolescents. And our capacity has not been, we haven't been able to offer that on a large scale, so we've often worked with specific counties that have indicated an interest and need to have clinicians trained in some additional skills. We, you know, as we all know, you know, the stigma around this topic is immense, and, you know, I think that there's been a lot of positive change in the Commonwealth and really nationwide that we've seen over the last couple of years, especially around talking about mental health, talking about suicide. But of course, awareness is a big part of our project, and also something that we've been able to really engage youth around and develop a lot of youth-focused activities to address the awareness piece. We are obviously working from our national strategy, and in fact, this is not completely related to the grant, but just kind of an update for Pennsylvania that we're working on revising our statewide suicide prevention plan. We used to have a separate plan for adults and older adults and then youth, and with Prevent Suicide PA, merging those two initiatives at the state level. Prevent Suicide PA is our statewide suicide prevention organization. We are also looking to have one consolidated state plan, again, a lifespan approach to suicide prevention, working from this national strategy. And so, again, the bigger goal of this project really is to raise suicide prevention to a level of priority statewide, and not just, you know, make it one thing on the checkbox for organizations, schools, colleges to have to do. And we have seen some great changes over the last few years. So this very colorful map of the state basically shows our main implementation strategies and where we've been, but I'll give a few caveats to this. So you can see that blue is anywhere that we've done training, red is anywhere that we've done screening, and then purple is anywhere that we've been able to do both or some combination of different suicide prevention related activities. And as much as possible over the course of this project, we've really strived to increase the number of counties where we're doing more than just one thing, because that shows that there's more of an ongoing effort in some way, shape, or form around suicide prevention activities, at least in partnership with our grant. Now, I fully acknowledge that there's a lot of great work being done in all of these areas, or a lot of these areas, completely outside of our grant work. But as far as our grant's concerned, we've tried to have multiple initiatives and efforts going on in any given county to build those linkages, right? So if we're just doing a one-time training somewhere, that might be reflected in the counties that have blue. The blue might also reflect a county where there have been multiple training efforts, so that's hard to fully capture on a map like this. So those are some of the caveats, that the blues might be just a one-time training, or the blues might be that there have been multiple training efforts going on in a county. The red would be counties, like I said, strictly that have screening efforts going on, and those may be taking place through the Student Assistance Program. And I'll speak a little bit about that. I'll talk about that in an ongoing way a little bit later. We also have had some screening efforts taking place on college campuses, but that's been to a lesser degree than our SAP efforts. And then we have been very fortunate to have also piloted universal behavioral health screening in school settings, and I'm happy to talk about that a little bit more later. That is something that really we took on as a pilot and didn't foresee as being a part of this effort, but something that we heard from several schools as a need, and something that they felt they had the capacity to carry forward. So we have been working with some districts on that too. But as you could imagine, anywhere where we've done training and we're also doing screening, you know, really just building up that infrastructure and capacity to address, you know, the problem of youth suicide. So what this bar graph represents is over the years of our project, and recognizing we're not fully done with year 5 yet, that's at the end of September, but it just shows the progression over time in terms of the percent of counties in Pennsylvania where we have been implementing these different strategies. So all the way to the right, I'm not sure if you can see my arrow here, but this is just the number, or the percentage of counties that have engaged in this project in some way, shape, or form, either through training or screening. And so you can see over the course of the project, especially between years 2 and year 3, we saw a really big jump. And I don't know fully what that's attributed to, but I know, you know, at the very start of our project, all of this was still pretty new, especially for schools, which is one of our primary settings. And some of our initial partnerships that developed were really focused around, you know, Act 71 just passed, we need to get this training done. And so we had a lot of initial conversations with schools about that. And it really was maybe a couple years into that where, you know, I guess word caught on that we did have a lot of training options that were available to schools. So that might attribute to that jump that you're seeing over here a little bit in terms of the overall county participation. But you can see, you know, and again, mostly between years 2 and 4, that's where we saw the most significant jumps in the different activities that we're doing, again, with the goal of increasing the percent of counties that are involved in more than just one suicide prevention strategy with our grant team. So any questions about that just before I move in? I'm going to talk a little bit more specifically about training through the project and then screening. Okay. Oh, yes. You can hear. Nope. Okay. All right. I'm getting a. Does everybody see this message of you're unmuted? Oh.
You're good, Perry. That was me.
Oh, okay. Are you seeing that, Jamal?
Yeah.
Okay. Let me just, hold on. Let me just stop share for a second. I can bring it back up. Okay. All right, so here is the basic training model for our project. With training, we have been able to offer that, I guess you could say, across multiple tiers of training. So gatekeeper training is usually the term used to provide any kind of general training on suicide prevention. So we've offered that. That usually covers the topics of going over myths, really addressing some of the stigma and preconceived notions that people tend to have about suicide, like talking about suicide to somebody is going to put the idea in their head. Also covering things like the broader risk and protective factors, as well as the warning signs, which are those observable behaviors, and then just general basics on how to respond. So many of you might be familiar with several of the trainings that exist that are evidence-based that cover these topics, like QPR, which is question, persuade, refer, youth mental health first aid, Cognito has some online virtual type trainings that get into these things. And then we as a grant team have developed some of our own trainings as well. When you do gatekeeper training, you might expect that those that are receiving the referrals would see an increase in those referrals coming in, which would be a desired outcome. But of course, we want to make sure that those individuals, which are typically the clinicians, if you're talking about a behavioral health care setting, or in our case, we did a lot of work with SAP liaisons, and also school mental health professionals like school counselors, school psychologists, school social workers. So we'd want to make sure that they are trained in risk screening or assessment for suicide, safety planning, the evidence-based intervention, post-vention, as well as family engagement, which is really a huge part of suicide prevention work when it comes to youth that have ongoing needs and also are in need of treatment. We know that the importance of the families being engaged and supportive in that process cannot be underscored in terms of positive treatment outcomes. So we have all of these trainings up here that we've delivered to those more trained professionals. And then for those that are in a position to actually offer treatment, we had some cognitive behavioral therapy training that came from the Star Center in Pittsburgh. Kim Poling has offered those through our project. And then we've done some targeted work around attachment-based family therapy, which was developed by Dr. Guy Diamond from our team. And in several counties, we've been able to offer not only the introductory workshop, but then provide supervision to clinicians that are working toward greater competence in the skills of ABFT, and eventually they could be working toward certification as well. So we've sometimes been able to offer an advanced workshop to clinicians in certain areas also. So again, just really kind of working across the continuum to build that safety net for youth. QPR is not the only gatekeeper training that we have supported through this project. We're really just supporting the concept of gatekeeper training, but we know more and more that people are looking at evidence-based trainings, and QPR is a very, it's broad enough that it's easily adaptable and very feasible to be implemented in a large range of settings. So while trainings like youth mental health first aid are fantastic, we know that logistically speaking, it's hard a lot of times to get that out into a setting. And in addition, QPR has a like a train the trainer model that's also been very feasible for us to offer in different settings. So with QPR, you're giving people like this very tangible skill set to be able to navigate a conversation with somebody that they're concerned about. And as I mentioned, it's something that can be readily adapted to the setting. So when we've done work in schools, we've been able to talk about that and how that fits into existing policies and procedures, what that might look like, and really the importance of the role of the gatekeeper in offering that connection with an individual, no matter how brief. So we have the instructor training for QPR is 8 hours in duration. So we've gone around the state, offered that in various places so that different counties, agencies, schools, colleges, they are building up their capacity to offer an evidence-based training and use that whenever and wherever they need to. Usually when offering QPR, most of you are probably very familiar with this, but you know, it's usually like an hour and a half, 2 hours in duration. So we've seen this being offered. There's actually a dedicated effort focused on training pre-service teachers in higher education settings, for example, where those before they go on to their student teaching experience, they're having the opportunity to get trained in this content. So through the course of the project, we have trained 325 instructors. And this has taken place in a variety of settings. I already mentioned schools, college campuses, behavioral health agencies. We've trained suicide prevention task force members. We've trained state employees, and I'm talking about as trainers to then be able to go and offer this training. So for example, juvenile justice, we did a big training for their staff, and this is something they're working into their training programs statewide. And we are talking about, especially as the new state suicide prevention plan is being looked at, how can we get this out further? Again, this isn't the only training. This isn't the be-all, end-all of suicide prevention training, but it is easy, it is feasible, it's an evidence-based one, and one that we have just been in a position to be able to offer more broadly. So, and then from a sustainability standpoint from our project, and even a capacity building, because our team is really small, we're 7 people, we haven't been able to get out statewide as much as we wanted to as the grants continued. So now there's this cadre of trainers in all kinds of settings, and we're actually in the process of looking at how we can build out a network of trainers to support them in their efforts around the state. And so that's something I can certainly share more about if anybody's interested in hearing, but you know, you can really see the impact of this effort in terms of just numbers trained, you know, through these efforts. Here's our map again, and this time we're looking at counties where there have been new QPR instructors that have been trained through the project. So we'll see, you can see that it's pretty heavy in the eastern part of the state. It's been a little bit harder to get out toward the southwest in particular. So if you happen to be in any counties where there aren't new trainers and it's something that you're interested in, we still are in a position to set up instructor trainings through the end of the project. And again, end of September of this year. So I'm happy to share more about that following this call, or even if people want to talk about it on this call. And I can pause now if there's any questions or any comments.
If you have any questions, you can feel free to unmute yourself.
Okay, so I will continue. So another part of our sustainability planning through this project, we have a team that has developed a range of different trainings over the course of time, and also several partners that have developed trainings related to suicide prevention that we want to be able to sustain if we don't have a new funding cycle, or even just because we want to get it out there more broadly. So we launched our online learning center in December 2017. We are working now with our web developers to add new courses. Currently, we have 15 courses on the site, and the way that it's set up, we have split up different trainings kind of based on role. A big part of what went into this was, again, with the school focus and knowing Act 71 is an unfunded mandate, we wanted to be able to offer free trainings for schools to access that have experts behind the development of that. And so we do have a 4-hour module specifically geared toward educators, and it's broken into 8 sections so that that can be done as half-hour modules over time. And I will say that even though it's geared toward educators, I think that any audience really can watch if you're supporting youth. But it is the general topics like myths, warning signs. There's a module on safe messaging. There's a module on postvention. So these are all free and available through this online website, and the website link is actually at the bottom of this screen. Essentially, before every class you take, there's a pre-post test, and then you can print out a transcript so that if you are in a school setting or supporting schools, they can hand that in to their district for Act 48 credit, or just have some sort of documentation that a course was completed. So the general course for educators is really what got us started with this, but there are also more specialized courses on the site too. So some of the other content areas I was talking about previously that were part of our training model, you can even see here. Some of the more clinical or specialized type trainings are also on there. So risk assessment, safety planning. We are working on getting a family engagement training up there. We're working on getting a postvention training up there. And I also mentioned that we've worked with some other grant partners. So for example, we have some trainings by Dr. David Brent, who's at the University of Pittsburgh, on creating a safer world and looking at gun violence and things like that. So I actually have all of the courses here now. So these are all of the courses that are available on the site, and several others that we will be adding in the near future. So you can see this one on the bottom left, that's David Brent. You know, some courses are geared more toward healthcare professionals. So for example, a pharmacotherapy of pediatric anxiety and depression. You know, and we are always open to feedback. So if there's something that you're looking at that you think should be on the site that's not, we would love to hear about that and see if it's something that we could work on with a partner. I don't think I mentioned that all of the courses on the Learning Center are free. That would be an important thing to underscore. So they can be accessed at any time. So the first time you would go to the website, which any of you could be very well doing at this moment, you do have to register to set up an account, but there's nothing that you would have to pay for whatsoever, and you would then be free to peruse what is available online. And since we did launch in December of 2017, we have had over 6,000 individuals register on the site, which is pretty fantastic. We're really pleased with that. We, as I mentioned, currently have 15 courses, but have several in the pipeline that we're just looking to get added on, hopefully several of them this summer. And one thing that I didn't mention about the Online Learning Center is that we did create facilitator guides for some of the modules. We know that when it comes to suicide prevention training, people really benefit from having face-to-face conversation, discussion, interaction, and this topic just brings up a lot of questions for people. And so if you're a setting where you wanted to be able to have ready-made content, but actually bring people together in a live format, then we have these facilitator guides. Right now we're just figuring out where to house them on the site, but they are available, and what you could do is bring a group of people together, but you would have the online course, and then there are basically just stopping points all along the way of the training where you would pause and facilitate discussion with people. So it's pretty straightforward. We have these for the more basic level classes, not the more clinical type classes, but for the basic ones, you know, we feel that many people might be in a position to facilitate a training on those topics. So those guides are available. All right, I am going to switch gears and talk a little bit about screening. And through this project, we actually have been in a position to offer the behavioral health screen, which was developed in part by Dr. Guy Diamond, who works on this project. Many of you may know him. And this tool was used pretty heavily in the first 2 Garrett Lee Smith grants that were focused on primary care. What we plan to do in the current project is really work with student assistance programs, because they're already screening and or assessing as part of standard practice. We wanted to offer a standardized and validated measure that they could really just slide into what they were already doing. Just hearing feedback around the state, there really was no standardized measures consistently being utilized. A lot of liaisons were using paper pencil measures or semi-structured type measures, which absolutely have their value. But if you want to be able to aggregate data and look at trends and things like that, a tool like this would allow for that, as well as bring greater consistency across professionals with regard to what questions are being asked. We know too that in SAP a lot of times the screening or assessment process is driven by the referral question, which it should be, but a lot of times the referral reason is maybe oversimplified. I know in SAP, you know, it's you have to choose one thing and a secondary thing when there might be many things going on. So screening broadly and always screening for suicide risk when there's other issues being presented is really recommended best practice. And so this has really allowed for us to screen more broadly for suicide risk and really to identify more students along the way. This shows some of the general content areas and domains that are addressed on the screen. So every student is screened for suicide risk, history, and current. It does use skip logic, so depending on what items are endorsed, other items will pop out. You know, and so gun access is something that is asked on the screen, and then the content scales you can see there: depression, suicide, anxiety, trauma, substance abuse, and eating disorder. So the measure's been cross-validated with several of the other screening tools that are out there in the field that are widely used. So for example, to validate the depression scale, it was looked at with the Beck Depression Inventory. And then other risk behaviors are also looked at, like substance use, safety, and bullying, so other items that often correlate with suicide risk or other mental health conditions. So it really does screen across a wide variety of areas. This is just for everyone's reference. This is not, this is only including our SAP agency partners, and I'll just leave this on the screen for a moment so that you can look and see if you happen to be a county representative or even a representative of a school or agency within a given county to see if there's anything familiar up here for you. It does not include the college campuses that are screening, and it does not include the specific school districts that I mentioned were involved in the universal screening pilot. Okay, so I'm going to move on. So this has quite a bit on it, and what I'll just point out at the top is that since the start of the project, over 18,000 youth have been screened, and that's across all of the settings that I just mentioned. You'll see the darkest purple bar on the left represents SAP screenings, and these are just the main scales, that the main domains that come up initially from the screen. And so the SAP screenings, of course, are a more targeted screen. You can clearly see the difference if you look at the bar all the way on the left, and then the third bar in, which represents the universal screening numbers. So that's general population. And those numbers have been pretty similar overall to what we see in our PAYS data, which is interesting. Our PAYS data are showing that around 16% of students in grades 6, 8, 10, and 12 have endorsed thoughts of suicide in the past 12 months. That's from the first slide that I showed. So the universal screening data is showing around 13%. So that's pretty similar. But schools that are participating in that pilot have expressed a desire to identify those students, and so that's what they're doing in implementing the universal screen. But of course, from a more targeted screen like through SAP, we would expect there to be a higher percentage endorsed. And then you can look at the corresponding percentages going across for depression, anxiety, trauma, eating disorder, and substance abuse. So since our efforts have mostly focused on SAP, this is essentially the numbers that we're seeing now. So about 42 agencies participating. So more than half of the counties in Pennsylvania have their SAP liaisons that are screening with this tool now. And they're serving over 60% of the districts in the state. And so that just really allows us to get a better landscape on the population of students that are going through the SAP process and the different concerns that we're seeing. And then, of course, about 3/4 of those students that are screened are then being referred for services, is what we're seeing at this point from the screenings that we're doing. And this is just a bit of a further breakdown for the SAP related screens. So on the prior bar graph that I showed, the suicide items were actually collapsed into suicide ideation, but that further breaks down into the percentage of students that report current ideation, which is about 7%, versus the students that present with a history of ideation. And the current ideation, the percent of current ideation is really important because in looking back at some of our SAP data over time before agencies were utilizing a measure like this, the identification rates were much lower. So it was more like 2 to 3% of students that went through the SAP process were being identified with suicide ideation, and that's based on our JQRS data that gets reported to the state. So because the agencies are now screening every student that comes to them as a SAP referral and not just on a case-by-case or I think I should ask the student those questions based on everything I'm hearing. It's a blanket, everyone that uses the VHS gets screened for suicide no matter what, and we are seeing an increased identification of students that have ideation. So of course that provides increased opportunities for intervention and referrals to supports and services that they need. Okay, and anything else on this graph? I'll pause for questions for a minute. You can see here, obviously, there's a discrepancy between the percentage of students that screen positive for substance abuse versus substance use. And I don't know if any of these percentages surprise you based on your experiences with the students and the data that you're seeing in your counties, but this is just the statewide landscape, at least from the counties that are participating.
Hello?
Yes.
Oh, hi. This is Barbara Maluski. I couldn't unmute, so I just wanted to go back, if I may,
Sure.
to the map. I'm from Schuylkill County, and I noticed that it's in red. Is that correct?
Do you mean the map at the very beginning, right? I can go back there.
Map. I'm having technical difficulties.
No, that's fine. This map, yes.
Yes, the county map, the red would be screening. Is that correct?
Yes, so you said you're from Schuylkill County.
Yes, I'm on the Suicide Prevention Task Force, but I'm also, as a volunteer, but I'm also a professional. So I had a question actually about the map and why we are in that category. And also that you mentioned you have training geared to healthcare professionals, which I don't think I'm aware of.
Mm-hmm.
So those are two items if you have time now. If not, I guess I can talk to you at another time.
Yeah, so I would have to look specifically to find out what sites we're in or have been in, because I don't have that readily on hand, but it looks like you're actually a purple pin, which means that there's been training efforts as well as screening that have taken place in the county. So if you're curious about what sites those are, I can definitely share that information with you.
According to our last meeting that I know of, there's only one site, pediatrician's office, and so I was very concerned and had actually volunteered to get more involved with the grant, and this is why I'm on the, today, to get more information. So I am aware that there is one pediatrician's office, a Dr. Belinsky. So unless that's not correct, and that concerned me because of our county having such high statistics.
Yes, and actually what I'm looking at here, so as far as screening, this is what I have. It looks like that the SAP agency, and I don't directly oversee the screening piece of our grant, but I could get you more information on that. But it looks like Child and Family Support Services is a SAP agency that's screening with the tool. Does that sound familiar?
Actually, it doesn't.
Okay.
As I said, the only one that I'm aware of is that pediatrician's office. And we do have, I'm sure we have members from the Child and Family Support Services area. So I could actually try to find out myself if they're still involved. But as I said, it doesn't pop up at the meeting, any discussion as to how this is going. And, so what my thought was, if I learn more about the grant through this, I could probably be more effective in helping out in our county.
Well, I would be happy to talk to you more afterwards and try to figure out, who the contacts are at these agencies. If they're not actively involved in the task force, I think it would be great to have that connection. And if there are other resources that this grant is focused on that, you'd be interested in, we could definitely talk further. Some of the healthcare trainings are currently available on the Learning Center. So I don't know if you're able to fully see this, but there are some trainings on concussions, depression, suicide risk, integrating behavioral health services with primary care, pharmacotherapy, and then some on method restriction. And we are, like I mentioned, looking to expand that even further. So yeah, maybe we can connect afterwards and try to find out more of what you're looking for.
Thank you. I actually lost the PowerPoint, so I thought I better jump in. I'm listening and I'm jotting down notes though.
Okay, but that's a good reminder for me that I'll make sure I'm explaining a little more clearly what's on the slides if people can't see. Oh, sure, thank you. The next piece, well, I didn't really talk about the universal screening efforts in our schools, but I don't have formal slides on that right now because, as I mentioned, it's just a pilot, but it is something that schools are really looking to be more proactive at identifying students at risk. It's not something that's a blanket recommendation for all schools at this point. We don't have the research behind to support it fully, and we know that schools really vary in terms of their capacity to do this work. But it is something that our governor's school safety task force, which convened last spring, it was a recommendation that was cited in their final report from those task force meetings to look at universal behavioral health screening. And there are several studies going on around the country and some published studies on it, but still a need to do more. Through our project, we are hoping to do something more formal around evaluating universal screening in schools as we continue on. But for now, the schools that are working with us have found that this is a practice that is feasible. It takes a lot of upfront planning, and so I can certainly talk to people more about that if there are questions, but it is a great opportunity for partnership between schools and SAP and other behavioral health and crisis. So it's something that we're continuing to explore, and we're hoping to develop some formal guidance around it this summer based on some of the lessons learned with our pilot sites. To move into student education and awareness. Awareness has been another huge component of our project, and I know that through task forces, there's a lot of awareness work going on in your counties. What I can share is that we found that the awareness activities focused around youth and engaging youth in those activities has been the most impactful. So we, in partnership with Prevent Suicide PA, do an annual PSA contest for high school students every year. For those of you looking at the PowerPoint right now, you can see on the right-hand side there is one of our PSA winners that a high school student created. It says "There's always hope," and it's a picture of an umbrella with rain and the suicide prevention lifeline number. So participating in this PSA contest provides our high school students with a really valuable educational opportunity because they learn about the warning signs, they learn about valuable resources like the lifeline and like the text line, and so they go through this process of using their creativity to create a message for their peers and really for their communities. And so we've been very fortunate to have been able to partner with some of the sports teams, the baseball teams in the state, around some larger scale awareness events where the student winners from this contest and their families have been able to be recognized. So the Phillies, the Pirates, and the Harrisburg Senators. They have all had a suicide prevention night at the ballpark event every year where they recognize those winners and they show their PSA on the Jumbotron, which has been really exciting. The students get to come, they get to table with us and give out awareness materials. A lot of times we try to use their images on magnets and things like that. But it's either a poster image they create or a audio clip or a video clip. And I do have the link to look at contest winners. It's all available on the Prevent Suicide PA website. I would also say that even if you're not in a school or in a position to work with high schoolers to create a PSA, you can access any PSA from any of the last 7 years of this contest to use anywhere, anytime. So if you're in a community setting, if you're in a healthcare setting, if you're on campus, wherever you are, you can print any of these images. They're all print ready. You just click on them when you get to the page. You can also access any of the video or audio clips. So for example, we had a movie theater in Lidditz that a couple years back, they showed the winning PSA before every movie in their theater for an entire month. And I think it was like a few years ago when one of the Star Wars movies came out. So for that entire month, everyone going to the movie saw that suicide prevention PSA before their movie started. So there's just a lot of really powerful ways that these PSAs, again, all free, all accessible, can be used in communities to spread the message. We have also partnered with 2 organizations that you may be familiar with, so Avidum and the Jana Marie Foundation, and both have really focused on engaging youth. Avidum helps schools to create awareness clubs where youth are empowered to lead these clubs and help figure out campaigns that they can do in their schools, really address its suicide prevention and creating this culture of I've got your back. That's what Avidum means, and the term was developed by a student actually. And so they create these clubs and they do all kinds of impactful messaging campaigns. And in addition to that, Avidum recently developed an actual curriculum for students. And so they have one for elementary, middle, and high school, as well as college. They're free through their website. We helped support that effort through grant funding. So if you're looking to find a curriculum that provides instruction on depression, suicide, and how to address these concerns as they arise geared toward youth, then you can access that on their website. And with the Jana Marie Foundation, we've supported them as well, and they actually created another kind of education program for youth that was focused on building resilience. So it does not overtly speak about suicide, but instead focuses on the protective factors and teaching students about mindfulness and positive mindset and healthy coping strategies. And so they actually go really nicely hand in hand, and both are free. So that's something that we've supported through grant work, as well as just working with the Department of Education around the messaging and information that goes out to schools. We created a guide of all of the available youth suicide education programs that exist, whether they are evidence-based or not, so that schools had an easy resource through which they could select different programs. And so certainly task forces or other organizations partnering with schools to support student education could also use this guide. It's available on the Prevent Suicide PA website, and I'll share that at the end. Okay, I just paused for a second because I thought there might have been something in the chat box, but feel free to interject if there's something. Okay, so I know we're coming up on the end of our time, but what I wanted to talk about is the next GLS grant and what we've proposed. Again, we're hoping to hear any day now because the new grant would actually start in less than a week at this point, and we have not heard decisions. So fingers crossed. But what we're looking to do, you see this language of Tier 1 and Tier 2 throughout these goals. Really, we want to, tier 1 essentially is going to be the continuation of some of our current efforts. So building up the training website to expand it and include more trainings geared toward more different types of issues as they relate to suicide prevention, and to really push that out and do some evaluation around the outcomes. The other piece of it is a continued effort around screening. So we do want to continue our screening efforts statewide across different settings. And the other piece of that I really didn't get to mention is that we've developed a higher education suicide prevention coalition, which is a collaborative effort of higher ed campuses throughout the Commonwealth, all focused around suicide prevention efforts on college campuses. And since the start of the grant, we've had over 50% of campuses engage with the HESPC efforts in some way. We have a website, we have an annual conference, we have message boards, and we've even offered mini grants to campuses that want to do something around suicide prevention efforts on their campus. So there's a lot of resources around that, and it's something very unique that we've been able to do as a state and want to continue. So that's all part of the Tier 1 piece. Now, the newer pieces of the new proposed grant really involve a more targeted approach. So this is the Tier 2 aspect, and that is very heavily focused on improving care transition and improving continuity of care for youth at highest risk of suicide. And we've heard in an ongoing way from SAMHSA especially that that's a priority area, and we've just seen it in our communities, right? So, you know, it's early identification, which you see in Goal 1, but that can be in any child serving system. So whether it's early identification happening in primary care settings, which we even heard about a little bit on the call, whether it's in schools, colleges, wherever youth happen to be, we want to build up that early identification and referral system even further in targeted counties. And then as youth are getting referred, increase the capacity among the providers, among crisis responders to do all of the screening and assessment and treating that needs to happen following that identification process. But then, of course, as I mentioned much earlier as well, it's youth coming out of hospitalizations or stepping down from treatment where sometimes those services tend to fall off, or we lose or don't even have that collaboration across the systems to figure out how to best support those youth. So in this approach, we're actually going to be going into some targeted counties to work with their teams to figure out like who are these stakeholders, how can we help improve communication, what are the gaps around continuity of care for youth at highest risk of suicide, and you know what can our grant team do to help address some of those gaps. So we really want to be involved much more in that direct work around continuity of care, and then hopefully be able to take lessons learned from the targeted counties that we work with to develop some state level guidance for counties looking to other counties looking to improve their continuity of care, and eventually develop toolkits and all kinds of resources from the lessons learned. So in a nutshell, those are the overarching goals, and certainly if we get awarded, we will be able to take next steps toward this work. But even if not, with the new task force convening that the governor's initiated, we're hoping that there can be greater focus on these pieces, no matter what, and hopefully not just for youth, which is what our grant is restricted to, but hopefully across the lifespan, because we know that there's a need. So I just want to underscore our national resources that we're working with, and the reason I know most of you are familiar with these, but we are taking some really specific steps to partner with these resources to get the word out more. And with our Lifeline, we're really looking to increase the number of county crisis centers that affiliate with the Lifeline, because currently only 37% of calls to the Lifeline that initiate from Pennsylvania phone numbers get answered in Pennsylvania. And that's a really big concern. It's something we want to focus on, which is increasing our capacity to answer these calls within our own state. And so that's a big effort coming out of our office right now, as well as we have a new keyword partnership with Crisis Text Line. So if people in crisis text PA to 741-741, we are going to be able to access some aggregate data to better understand the users and what their needs are, and things like user satisfaction. So how helpful do they feel like this service is, and some other data points such as the number of active rescues and things like that can really help inform our prevention efforts. So that those are the national resources. Prevent Suicide PA is our state level organization, supported in part by funds from OMSAS, And many of the resources that I mentioned on today's webinar are available all through the Prevent Suicide PA website. And you can also access the online training site, the Learning Center, through Prevent Suicide PA as well. And this is my contact information. So anybody that's looking to get in touch to talk about any of these things further, I think we have a few minutes to talk about some things now if anyone has questions, but otherwise please feel free to get in touch with me, and I really do appreciate everyone's time this afternoon.
Thank you, Perry. There were a couple of questions in the chat box, and I'll unmute everyone in just a second so that if you have any questions for Perry that you can ask them. Alan Tien wanted to know, are there any considerations underway regarding Medicaid and other reimbursement opportunities?
Hi, Alan. For the screening tool, I'm guessing that your question is mainly about screening.
No, actually, much more broadly, more for services actually, because it's really, you know, with the expansion, you have lots of services that'll be incorporated.
So at this point, I haven't been involved in any of those conversations, but I do expect that that will be something that the task force is going to be looking at as we go about that process. I'm very much expecting that to be brought into that conversation. So hopefully we'll have some information coming out of that.
Good to know. And at any point, we're happy to, you know, add our thinking in that area, you know, which is just to make it more efficient and really help the providers, you know, do well in supporting all the services. So.
Thank you.
All right, and Perry, Kimberly Pape wanted to know, will the training opportunities remain accessible after the grant has concluded?
So we are absolutely certain that the online learning center will remain accessible. So that's why we have spent a lot of time trying to build up the training site. And we're looking at, like I mentioned, to expand the content that's available on that site over the summer, you know, hopefully as much as we can before this current grant ends. And yes, that will continue to be available. Prevent Suicide PA, as our statewide organization, is supporting that in an ongoing way, and we will kind of be unfolding further plans as time goes on. The other, you know, more in-person training efforts, I can't necessarily speak to that, but with at least with our QPR efforts, we've really been looking to get more people trained out in various settings to then be able to carry that forward. So that has been a big push as well, in addition to the online learning center.
All right, does anyone else have any questions? I unmuted everybody's mic just in case.
Hello?
Go ahead.
Oh, this is Barbara again. Since I lost the view of the PowerPoint, could you speak the contact information that you just mentioned was on the screen, which I don't have now?
Yes, absolutely. So my email address is c-prosen, P-R-O-S-E-N, @pa.gov. And that's usually the best way to access me. But I can give my phone number as well. My office line is 717-772-7858. And my mobile number is 717-303-4611. And Jamal, I think, well, this is being recorded, so I think that this will also be shared afterwards in case anybody needs to reference any of the slides or my contact information.
Thank you.
All right, do we have any other questions? Okay, well, it's just about 3:30. So we're going to say thank you to Perry again for doing this presentation, and we will keep you all abreast of what we will be doing next month for our county collaborative training, and we hope to see you then. So with that, I wish you all a good day, and thank you for participating.
Thank you.
Thanks,
Thank
everyone.
you. Bye-bye.
Bye.
Bye.